Scoliosis by the Pediatric Orthopaedic Society of North America. What is scoliosis? I want to talk to you today about scoliosis, which is a condition which makes the spine curved instead of straight. These curves can make the shoulders, hips, or waist appear uneven. This is usually checked by pediatricians during adolescence by using a screening test where a child bends over. If your pediatrician sees an abnormality, you may be referred to a pediatric orthopedic surgeon for further examination. What happens at the orthopedic office? At the orthopedic office, the orthopedic surgeon will examine you and take x-rays of your spine. Scoliosis comes in a variety of different forms. Congenital, which you are born with, which means there is a funny shaped vertebra causing the scoliosis. Neuromuscular, which is associated with conditions such as cerebral palsy or muscular dystrophy. Syndromic, which is associated with known syndromes such as Turner's, Marfan's, or achondroplasia. Finally, idiopathic, the most common type. Idiopathic is fancy for we don't know, and unfortunately, that is the case with idiopathic scoliosis. We do not know why it happens, who it happens to, and we are still trying to understand a lot about it. We will be talking about idiopathic scoliosis today. Scoliosis does not result from carrying heavy items. It does not result from sports or poor posture. Scoliosis usually does not cause back pain. We really care about scoliosis while you are growing, because as you grow, your spine grows and your curve can grow. The goal of conservative scoliosis treatment is not to make the curve better, but to stop it from getting worse. At the orthopedic surgeon's office, an x-ray will be performed so we can measure some angles. We classify scoliosis by something called the Cobb angle, which is a measurement of the severity of the curve. What does the Cobb angle mean? An angle of 0 to 10 degrees is considered normal. If we took x-rays of 100 people walking down the street, many would have a curve of less than 10 degrees. An angle of 10 to 25 degrees is considered mild. An angle of 25 to 45 degrees is moderate, and an angle greater than 45 degrees is severe. We'll talk a bit about each of these curves. We use the Cobb angle to guide our treatment in growing children. An angle of less than 10 degrees does not need further x-rays or follow-up. A mild angle of 10 to 25 degrees is observed with close follow-up and serial x-rays every few months. A moderate angle of 25 to 45 degrees is treated differently with bracing, physical therapy, and supplementation. An orthotist will fit you for a custom brace. A special physical therapy called Schroth physical therapy may be used. Calcium and vitamin D supplementation in combination with bracing and Schroth physical therapy has been shown to decrease the progression of the curve. Severe scoliosis with an angle of greater than 45 degrees is usually treated with surgical intervention. More on this later. How long will I be treated for? Your orthopedic surgeon will monitor what stage of growth you are in. Sometimes a hand x-ray or an x-ray of your pelvis are used to understand how much you are growing. He or she might also ask about your shoe size changing, any increases in height, or the height of your parents. If you are a girl, the doctor may ask questions about when you had your first period. Once your orthopedic surgeon thinks you are done growing, and if your curve is less than 45 degrees, it is unlikely that your curve will get bigger. At this point, treatment is usually stopped or weaned. What if I need surgery? If your curve is greater than 45 degrees, it may continue to get bigger, even after you are done growing. As curves get larger, they can not only be cosmetically unappealing, but they can also cause pain and problems with lung function. Because of this, orthopedic surgeons usually suggest surgical intervention when the Cobb angle is more than 45 degrees. The surgery is called a PSIF, or a spine fusion. The surgery is a big surgery, but it is very safe and effective, and we recommend speaking with your board-certified pediatric orthopedic surgeon for further details. In summary, when you see your pediatric orthopedic surgeon for scoliosis, you can expect a physical exam and x-rays to help us get a better understanding of your scoliosis. Please remember, our main goal is to stop your curve from getting bigger, and we have lots of ways to try and make that happen. If needed, surgery is a safe and effective option, which you can learn more about from your pediatric orthopedic surgeon. Thank you. For more information about scoliosis and other topics in pediatric orthopedic surgery, please visit our patient-friendly website, orthokids.org.